Hello, welcome to another episode on this channel. My name is DrBeeH and this channel is for you. This channel has been created to promote health information, to educate people about their health. When you have the right information, you are able to make the right decisions. That is the whole idea of this channel. I am promoting the right attitude because people still are lured into taking all sorts of things that do more damage to their body than good to their body. And then they present late to the experts who would have helped them in the first place. So be informed and take the best decisions. Today, I'm going to be talking about endometriosis. I'm sure at some point in your life, whether you had a friend in school or your niece or your sister, or maybe it has happened to you or is still happening to you, you knew someone who had extreme excruciating pain each time it was their menstrual period. I'm not talking about normal cramps. I'm not talking about discomfort during menstruation. I'm talking about debilitating pain where the person cannot function because they are rolling in pain, screaming, crying. And sometimes we treat them badly because we tell them things like, every woman goes through that, put yourself together. But it might be endometriosis because endometriosis gives such excruciating pain. What is endometriosis? Endometriosis is the growth of endometrial-like tissue outside of the uterus. So the endometrium is the lining of the uterus. But this time around, tissue that is like the lining of the uterus is growing on the ovary, on the fallopian tube, on the bladder, or on the uterine wall itself. It could grow anywhere. I've read about cases where it's been found on the spleen. So it could grow anywhere. And like I introduced this subject, one of the major symptoms of endometriosis is extreme excruciating pain. In addition to the pain, typically just before and around their menstrual period, some have pelvic pain that is just kind of recurrent because of this inflammation. Many times the endometrial-like tissue is in the pelvic region. So there's always some pain at some point or the other if there is something that triggers the endometrial-like tissue. I want you to also note that because this is an abnormal situation, it creates a cycle of inflammation and scarring. So it's like a wound that wants to heal and then it's peeled off again and then about to heal and then it's peeled off again. So inflammation just continues on in that way. So there is pelvic pain. And many times these people are misdiagnosed as having inflammatory bowel syndrome because they usually have this pain on a chronic basis and it's just assumed that it's inflammatory bowel syndrome because the presentation could be pretty similar. Some also have pain while trying to urinate, especially during their period. Another symptom is pain during sexual intercourse. So for women who are already sexually active, they notice that each time they have sex, they do have pain because, it's the pelvic area and that pain is kind of triggered when they have sex. Another major symptom is infertility. So some of the women have infertility. And for some, that is really why they are seeking help because all their life, they have borne the pain like a cross. They've imagined that, well, this is my lot. It comes with menstruation. And until they are now trying to have babies before they seek medical help. This does not have to be the case. And that's why you're hearing this today. So you can take action for that person you know and share this information with them. So those are the symptoms of endometriosis. But the symptoms would present based on the location of that endometrial-like tissue. And it is not that every woman will have all of the symptoms. Some will have maybe none because it might just be a very small endometrial-like tissue and they do not have pain. So that takes me to trying to understand endometriosis and diagnosing endometriosis. Recent studies is now showing that endometriosis is being managed like an inflammatory condition and a systemic condition, not just seeing it as a reproductive health problem. They are approaching the health of the woman so she can lead and live a normal life, because it is so debilitating. During their menstruation, they literally cannot function because they bleed so much, they are in so much pain all through. Normal cramps will ease off by the end of the first day of the menses, but this is not like normal cramps. It is extreme pain. So that is how that presentation should, sound I don't want to use the word alarm, because it shouldn't. The idea is not to create panic. The idea is to make you research and see if there are other symptoms that might make it similar to endometriosis, because early diagnosis helps. You might say, well, I could deal with the pain, but the longer the inflammation continues to go on in the body, the more difficult it becomes to manage. Some of the current management, it has been traditionally management with contraceptive pills, so that the hormones can be balanced, reducing the effect of estrogen and trying to reduce the triggering of all those endometrial tissues in the woman's body. But there's more research going on, and more people are going into the particular management of endometriosis, such that they counsel that doctors should not rush into surgery, because you really want to know the extent of the endometriosis. It's one of the key things now. You want to know the extent of endometriosis before you think, oh, I want to go remove the endometrial-like tissue on the ovary, for example. It's usually very common because many women tend to have that, and sometimes it will look like a mass. They could even be misdiagnosed as an ovarian tumor. It is important that the staging is understood before there is rush into care. One of the things that is also important to note is that we should treat people that have endometriosis with empathy, because they are going through a lot of pain, but they do not have to. So we can help them. We can share knowledge. And just before I round up the episode today, I want to mention and give a shout out to Dr. Brighton. I came across her channel, and she suffered from endometriosis, and it inspired her to share her story. And on her channel, she has brought experts that talk about endometriosis, and particularly, she's going to do something in March. And I'm going to paste the link in the comment section, and you can actually see the link as well on the screen right now. Creating an endometriosis toolkit for people who suffer from endometriosis. So if you need to learn so much about endometriosis, you can learn more, because she has episodes on it. And before you even go to the doctor for care, you might want to do some research on your own, so you can match your symptoms with some of the things that I've talked about and what some of the experts on our channel have talked about. That guides you to know what you might likely be dealing with, and you can have a meaningful conversation with your doctor. In this situation, your doctor should be a specialist OB-GYN. If you have one that specializes in endometriosis, fantastic. But if who you can find is a gynecologist, it is equally good. But ensure that you seek help early. And the good news is, it doesn't stop you from having children. The person I just talked about, Dr. Brighton, has her kids. So endometriosis, if well managed, even though it could cause infertility, does not mean you cannot have your own children. If you found this topic helpful and you think you can help another woman that you know, another lady, another girl child that is suffering from endometriosis, please like, comment, and share with them. It is important. And as you subscribe and, hit the notification button, you'll know when new things are being talked about. Remember, your health is your greatest asset. Until the next episode, I remain Dr. B, and bye. Take care.